Since the discovery and the start of the HIV/AIDS epidemic in the 1980s, 79.3 million people have become infected globally. 36.3 million people have died in total all over the world. While the attention shifted to COVID, 1.5 million new HIV cases were diagnosed in 2020 throughout the world. Today, there are around 37.7 million people living with HIV. Since the epidemic, 680,000 people have died. The human immunodeficiency virus attacks our immune system. When a person's immune system is down, it makes you prone to getting very bad infections and sometimes cancers, and this could lead to death if untreated. Most people get HIV via anal or vaginal sex, or by sharing needles with a person with HIV, through exposure to infected blood. HIV can also be passed on by an infected woman to her baby during pregnancy, childbirth, or later on via breastfeeding. You cannot get HIV through touching, hugging, kissing, breathing the same air or sharing the same space, or sharing food or drinks or utensils with a person with HIV. Anyone, regardless of age, gender, country, level of education, financial or social stature in life, can get HIV. In our modern world, most people living with HIV are adults, but almost 2 million are children, and alarmingly, more than half are women and girls. According to the UNAIDS data, certain practices place people at risk than others. People who inject drugs are 35 times more likely to get HIV. Trans women are 34 times more at risk. Those who exchange sex for money are 26 times more at risk. And the risk of getting HIV is 25 times higher for men who have sex with other men. In the Philippines, there have been 90,960 total HIV cases since the 1980s up to September 2021. This year so far, 8,945 new cases were reported. With stigma, lack of access to testing in some provinces, and the effect of COVID on HIV essential services, this number is likely underreported. In the Philippines, the average daily number of cases has been rising significantly. In 2011, we were averaging 6 new cases a day. This year, the estimate is 33 cases daily compared to just 22 per day in 2020. Let's say that again. This year, there are 33 Filipinos diagnosed with HIV every single day. Local data shows that the most common mode of transmission among Filipinos is male-to-male sex at 81%. Male-to-female sex was at 15%. From 1984 to September 2021, 29% of the reported cases were 15 to 24 years old. 97% were infected through sexual contact. Since 2004, more males were diagnosed in this age group. However, the number of diagnosed HIV female youth has increased significantly in the past 5 years. This year, diagnosed females aged 15 to 24 years old were 5 times higher compared to those in 2011. 3,924 were 19 years old and younger at the time of HIV diagnosis. While most were 18 to 19 years old, alarmingly, 14% were just 15 to 17 years old at the time of diagnosis. If sex is the main mode of transmission, imagine how much impact appropriate guidance and safe sex education can be for our youth. Just this September alone, there were 981 new HIV cases reported in the Philippines, and Region 6 is in the top 4. Since 1986 to September 2021, these are the total HIV cases in Western Visayas. This 2021 alone, 742 new cases were reported in Western Visayas. This is the breakdown according to province or highly urbanized city for the year 2021. With testing and early diagnosis, compliance to daily antiretroviral therapy and medications, close follow-up, and the proper kind of support from society and the home, People with HIV can now live a normal lifespan. Unfortunately, a lot of people are still diagnosed late. Just last month, 16% of new cases diagnosed already had advanced symptoms of HIV or full-blown AIDS at the time of testing. This means these people were living with HIV for several years without even knowing it. The only way to know if you have HIV is to get tested. Nowadays, testing is very easy. There should be no shame in getting an HIV test. Anyone aged 13 to 64 years old should get an HIV test at least once in their lifetime. People in monogamous sexual relationships should also get tested. HIV screening should be a part of routine tests for pregnant women. If you are a sexually active gay or bisexual man, you should get tested every 3 to 6 months. People with risk factors or high-risk behaviors should get tested more often, at least once a year. If you've tested negative before, but you have any of the following, you should repeat the test. If you have more than one sexual partner, if your partner has more than one partner, or if you exchange sex for drugs or money, if you were diagnosed with another sexually transmitted disease, or hepatitis or TB, or if you've had sex with anyone who met these criteria, you should repeat your HIV test. HIV testing can save your life, protect others, especially your loved ones, and prevent the spread. This World AIDS Day, let's be more informed. Let's be more safe and practice safe sex. Know your status and get tested. Let's end the stigma. Let's work together to end HIV.